So hi everyone, in today's video we are going to deal about rectum and anal canal. So first we will deal with the dilated part of our gut, that is rectum region. So talking about rectum, so this is the most dilated part seen in the pelvis. So the colon, we have got many parts as we know, from cecum, ascending colon, transverse colon, descending colon, sigmoid, and later sigmoid is going to give a dilated part which we are seeing here, and this is the rectum region. So I will show you here. So this part is rectum, which you are seeing here. This dilated part, which is seen in the pelvic region, is considered as rectum part. So this rectum is dilated. You can make out here in pelvis, the most dilated part is the rectum, and compared to the other parts of the gut, such as we have got ascending, descending, transverse, and sigmoid colon. There we will be having tinea coli, circulation, and appendices epiploicae, which are the major features of large gut. So large intestine, if you are taking, we have got some important feature, that is tinea coli, circulations, and appendices epiploicae, which are peculiar features seen only in large gut, whereas in rectum region those three are absent. Here you can make out this is sigmoid. Here you can see those pouches, that is nothing but appendices epiploicae, and then we have got circulations and all. So those features will be seen till sigmoid colon. Later in the rectum you can't see all these three features. Then the name rectum it got us. Rectum means usually it is called as straight tube. So the straight area we will call as rectum. That's why it is called as rectum region. Here this rectum is misnamed in human beings. In animals it is straight tube, but in human beings it is pulled forward. It is having a curve. It will not be straight. So this is misnamed in human beings, whereas in quadrupeds, that is in animals, it is straight. That's why it is called as rectum. Whereas in human beings, it is bent as it is pulled forward by a puborectal sling of a muscle called levator ani muscle. So in pelvis region, we have got a muscle called levator ani, which is giving a sort of fiber which is forming a sling around the rectum. We will call that as puborectal sling, which is giving that bent nature of rectum. Then we are going to see about the extent and dimension. So anatomically how it is oriented, we are going to see. First we are going to see about the extent and its dimension. Talking about the extent, it is going to extend from here. You can make out behind we have got S3 vertebra. This whole thing is sacral vertebra, which is having 5 bodies: S1, S2, S3, S4 and S5. Now the extent of this rectum is from the S3 vertebra. So from the S3 vertebra, in front of S3 vertebra it will start, and then it will end up 3 centimeter in front of the coccyx. So 3 centimeter in front and below the coccyx it will end. So till here we have got rectum. So from S3 till the 3 centimeter below the coccyx we have got the extent of this rectum. We can tell like here we have got rectosigmoid junction, which is going to continue as rectum. Later it will end up in anal canal. So this junction is called as anorectal junction. So this is the whole of rectum we have got. Talking about the length of rectum, it is about 12 centimeter, and the breadth of it will be 4 centimeter. So here you can see some difference in upper part and lower part. In the upper part, it is about 4 centimeter breadth. In the lower part, it will be dilated. So this dilated part of rectum is called as ampulla. So this is ampulla of rectum, and when empty, what will happen is this anterior and posterior wall will get approximated to each other, and in that condition, if you are taking a section, it will have a transverse slit. So this is how we have got extent and dimension of the rectum. So now moving on to the curvature or flexures which are present in the rectum. So here in rectum we have got curvatures which are 2 in antero-posterior aspect and 3 in lateral aspect. So we have got curves in the antero-posterior aspect, 2 in number. In the lateral aspect we have got 3 curvatures. So in the antero-posterior curvature, we have got two, as I said before, we have got two curves. One is in front of the sacrum. So above we have got sacral curve, and below we have got perineal curve. So this sacral curve which will be convex backwards, whereas perineal curve which is present in the anteroposterior aspect of lower part is convex forwards. So this is the two difference we have to make. We have got two curvatures in the anteroposterior aspect, one is above, another one is below. The above one is convex backwards, the below one is convex forwards. And this convexity is made by puborectal sling, which we already have seen. Now we are moving on to lateral curvatures. So talking about lateral curvatures, as I said before, we have got three lateral curves. So this is right hand side and this is left hand side. So here in the right side we have got two curvature. You can make out here. So here we have got two curvature. So this is one curvature and this is another curvature. Whereas if you are taking left side, we have got only one curvature present. So this is both the lateral curves we are dealing now. So in the lateral side, two on the right side and one on the left side will be seen. The upper one, first we will move on to the right upper curve. So talking about right upper one, we have got convex curves towards the right side and at the junction of S3 and S4 vertebra. Talking about middle curve, it is convex to the left side and it is seen at the sacrococcygeal junction. Talking about lower one, so that is third one, this curve, it is convex towards the right and it is related at the tip of coccyx. So these are the lateral curvatures we have got. Anteroposterior, as we said, which are two. In lateral we have got curvature. And here this lateral curves have some significant feature, that is, these are considered as rudimentary saculations on the sides of the rectum. And here along the concavity of this lateral curves we have got horizontal rectal valves project into the interior of rectum. So in the interior we have got some horizontal rectal valves will be projecting, which is going to support the weight of feces. So this is the significant feature of lateral curve which is seen on the right and left side. So now moving on to peritoneal relation. So we are going to see about relation of this rectum. We have got peritoneal and other relations. So first we are moving on to peritoneal relation. So peritoneum, we are for seeing peritoneal relation, we are dividing the rectum into upper part, middle part and the lower part. In the upper part you can make out this is the peritoneum which you are seeing here, which is covering the front and also the sides. So front and sides of the rectum will be covered by peritoneum in the upper part. If you are taking the middle part, it is going to cover only the anterior aspect. And if you are seeing the lower part, it is non-peritoneal. So no peritoneum will be covered here. So we are dividing upper, middle and lower. Upper part, it is covering the anterior and on the sides. In the middle part, only the anterior aspect, and in the lower part, no peritoneum will be seen. So this is the feature or peritoneal relation of rectum we got. Now we will move on to other relation. Other than peritoneum, what are the structures related we are going to see. That is visceral relation. In males, how anterior relation will be differing from the females. So first we will move on to male anterior relation. So in males, so this picture it is showing section of male pelvis. So here anterior to this. So we have got upper, middle and lower part. In this you can make out they have got anteriorly related to urinary bladder, the rectum, anteriorly related to urinary bladder, seminal vesicle. So here you can make out this is urinary bladder and this is second one, this is seminal vesicle, and then we have got vas deferens and this is the prostate part. So we have got prostate here and then terminal part of the ureter also will be seen. So these are the relation in the anterior aspect. And also between the rectum and the urinary bladder we have got a fascia extending. Here you can make out this fascia is called as Denonvillers fascia, which is nothing but rectovesical septum between the rectum and urinary bladder. So we are calling it as rectovesical septum. So these are the structures related in the anterior aspect. So anterior aspect, non-peritoneal part of rectum is related to urinary bladder, seminal vesicle, vas deferens, prostate and the rectovesical septum. In the upper part, we have got peritoneum related. In front of peritoneum, we will be having coils of sigmoid colon and small intestine will be seen. Now in female we are going to see, in female upper two-third, as you know, it is covered with peritoneum, and this pouch we will call as recto-uterine pouch, that is between the rectum and uterus we have got recto-uterine pouch, which is otherwise known as pouch of Douglas. So here we have got some contents such as we have got sigmoid colon and coils of ileum C. Now in the lower one-third, that is non-peritoneal part, it is related to posterior vaginal wall. So here you can make out this is vagina. You can see below the uterus, and posterior vaginal wall will be related anterior to the non-peritoneal part of rectum. So this is how we have got anterior relation of rectum C. In male and female it is different, we have to note. So now we are moving on to posterior relation. So talking about posterior relation, we are dividing into midline relation and lateral relation. So in the midline, the rectum is related to some structures such as S3 to S5 vertebrae will be related, and then we have got median sacral artery related, and here you can make out ganglion impar. So these are the structures related in the midline of the rectum posteriorly. Talking about lateral aspect of the rectum posteriorly, we have got three muscles related. Piriformis, so here you can make out piriformis, coccygeus and levator ani muscle, and also the sympathetic trunk or sympathetic chain. So that also will be related, and along with that we have got lower three sacral nerves also passing lateral or posterolateral to the rectum. So this is how we have got posterior midline structures and posterolateral relations of the rectum C. So this black outline is rectum, and the structures which we are seeing here is relation of posterior midline and lateral relations. So now we are moving on to lateral relation. So we have seen anterior relation, which is differ in male and female. In posterior it is same, that we are dividing into midline and lateral, posterolateral. Now we are moving on to lateral relation, that is here. So here you can make out rectum too. On the either side we have got pelvis with the muscles covering it. So here we have got levator ani muscle and coccygeus muscle related, and here between the pelvis and the rectum, this space we are calling as pararectal fossa. So on either side laterally we have got pararectal fossa related. So lateral relation we have only the fossa present, that is pararectal fossa. So now we are moving on to, we have seen all the external relation and the peritoneal relations in detail. Now we are moving on to interior aspect of rectum. So talking about interior aspect, we have got mucus covering seen over there. So here in the mucus covering we have got two types of folds present. One is temporary fold, and another one is permanent fold. These temporary folds which you can't see over here, because it will disappear when the rectum is distended. So distended view only we are seeing here, which will be longitudinal. So interior of rectum we have got longitudinal folds seen here, which will usually distend when the disappear when the rectum is distended. Now we are moving on to permanent folds of rectum. Talking about permanent folds, these are known as Houston's valves. So permanent folds are nothing but Houston's valves, which are horizontal in shape and also semilunar, and these mucosal valves will be seen along the concavity of lateral curvature of rectum. As we already have seen about the details of lateral curvature, we have got right two lateral curvature and in the left one curvature. So in the concavity of those curvatures we have got this lateral, we have got this Houston's valves present. Now we have got this Houston's valves which are four in number in rectum. So among that, first and third valves are constant, whereas second and fourth valve will be considered as inconstant valves. So about the valves we are going to see in detail. So as I said, we have got first valve and second valve seen over here. So first valve will be seen over right or left side. It will be seen either in the right or left side, and here it will be seen opposite the S3 vertebra, and if we are measuring, it will be from the anal canal, it is 12 to 14 centimeter above. From the anus it is 12 to 14 centimeter above. And if we are seeing the second valve, which is inconstant, it is about 7 centimeter or 7.5 centimeter above the anus, that is 2.5 centimeter above the third valve, and it is seen in the lateral curve, that is here. So it will be seen towards the left side. Now we have got the third valve, so which is very important. So it is a very significant and constant valve seen, and this third valve, it is about 5 cm above the anus, and sometimes it will encircle the whole of the rectum. So whole of the rectum will get encircled by this third valve, and such condition we will call as Nilletons sphincter. So the condition where the whole of the valve is encircling the rectum we will call as Nilletons sphincter. And then we have got one more valve, that is fourth valve, which is 2.5 cm above the anus or below the third valve, and this is considered as lower lateral curve, and this is also inconstant valve. So we have got four valves. Among the first and third are important and which are constant. Among the third valve, which is going to form a circular muscular fiber surrounding the rectum, we will call as Nilletons sphincter. Now what is the significance of all these valves is, as we already seen, it is going to support the weight of feces in man who is having an upright posture, and it is also going to prevent passage of instruments from the anus. So these are the importance of presence of the Houston's valves in. Talking about the arterial supply, it is supplied by 5 arteries, such as we have got middle and inferior arteries are paired, and whereas superior will be unpaired. So 2 middle artery and 2 inferior rectal artery and 1 superior rectal artery will be supplying the whole of. Talking about venous drainage, we have got two venous plexus present. One is external one, another one is internal venous plexus, which is going to drain whole of the rectum, and then it is giving towards the rectal veins. Here you can make out. So first we will move on to internal venous plexus. So here you can make out, this is the internal venous plexus and this is the external venous plexus. So internal venous plexus, it is seen surrounding the anal canal just above the Hilton's line. About Hilton's line, I will teach you along with anal canal. So this is the Hilton's line. Just above the Hilton's line, we have got this internal venous plexus that is present between the mucous membrane and also the muscle called internal anal sphincter muscle. So between these two, we have got this plexus present, and it is continue above with the superior rectal vein, and then it is going to continue below with external venous plexus. So this is the communication of the or drainage of the internal venous plexus. So talking about external venous plexus, it is situated between the perianal skin. So this is the skin area. So between the perianal skin and the subcutaneous part of external anal sphincter. This is external anal sphincter, which is having three parts. Among that, this is subcutaneous part. Between the perianal skin and the subcutaneous part of external anal sphincter, we have got this external venous plexus present, which is continuing laterally with inferior rectal. So here you can make out the internal plexus is going to drain in superior rectal vein and also to in middle rectal vein. And here this internal plexus is going to communicate with external plexus, which is going to end up in inferior rectal vein. Talking about lymphatic drainage, for this purpose again we are dividing the rectum into three parts. So lymphatics of the rectum will be collected in such a way, the upper part of rectum will drain into left common iliac lymph nodes, and the middle part will get drained on either side to pararectal lymph nodes. And sorry, it will drain into internal iliac lymph nodes. Sorry about this. So rectum, we are dividing into upper, middle and lower part. In the upper part, it is draining into left common iliac from either side. In the middle part, on either side, it will go and drain into internal iliac nodes. In the lower part, some of it will go to internal iliac, some will go to superficial inguinal lymph nodes. So this is how we have got lymphatic drainage of rectum seen. Usually in other parts of the gut, the lymphatic drainage is transversely passed, whereas in rectum it is passing longitudinally. So obstruction of we have got a cancer of rectum or anal canal will not cause any obstruction to other parts of the gut because of the longitudinal drainage. And talking about nerve supply, we have got sympathetic and parasympathetic type. Sympathetic nerve supply is mainly by superior hypogastric plexus, which is going to give vasomotor sensation to the arteries over the rectum. And then we have got parasympathetic, that is by pelvic splanchnic nerves, that is S2, S3 and S4, which is secretomotor to glands. So then going to the final part, we have got some supports for the rectum to be in proper position, that is mainly by puborectal sling of levator ani, which is giving the curve, and then we have got a reflection of pelvic fascia extending, and then lateral ligament of rectum and pelvirectal and ischiorectal pad of fat. All these are the things which is giving support to the rectum. So these are about the details of rectum we have to know. So rectum, we have to know about the general anatomical feature, and then we have to know about curves, and then about the relation, peritoneal and visceral relation, and also the interior of rectum with arterial supply, venous drainage and lymphatic drainage. Thank you for listening. In this video, we are going to see details of anal canal. That is the most terminal part of gut tube we are going to deal now. So which we will call as anus or anal canal. So talking about anal canal, as I said, it is a terminal part of the large gut. And here the extent of this anal canal is from the anorectal junction. So here we have got rectum. So this rectum is going to continue as anal canal, and this junction part we will call as anorectal junction. From the anorectal junction till the anal orifice we have got extent of this anal canal. And this is going to extend between the clefts between two gluteal region, and it is about 4 cm just below and in front of the tip of coccyx. Now we are going to see some peculiarities, that is, in anal canal the anterior wall is shorter than the posterior wall, and it is surrounded by anal sphincters. So it is always closed except during defecation. So talking about the anatomical feature, first we are going to say about the dimension of the anal canal. The length of this anal canal is 3.8 cm. So only this part we are going to deal. This is about 3.8 cm. The breadth, when empty, the lateral walls are approximated with each other, which is going to give an anteroposterior slit. Got bulb of penis, perineal body with urethra, and in females we have got posterior wall of vagina with perineal. Now we will move on to the important aspect of anal canal, that is interior of anal canal. So talking about interior of anal canal, we are going to divide the anal canal into three parts. One is upper area, another one is intermediate, and then we have got lower area. And these three areas will be divided by means of two important lines. Here you can make out dotted lines, and another one this thick and black line. So this dotted line is going to indicate a line called pectinate line. So this is pectinate line. What it is, I will explain you later. And then we have got the lower line, and this line we will call as Hilton's line. So these are the two lines which is going to divide the anal canal into upper, intermediate and lower area. So first we are going to see about upper area, that is just above the pectinate line. So in the upper area we have got some features. Among that, first feature which we are seeing is we have got longitudinal folds present. So these longitudinal folds are about 6 to 10 in number, and these folds are called as anal columns. So this is the first feature seen in the upper area. This upper area which will be around 15 millimeter long, middle area also 15 millimeter, and in the lower area also 8 millimeter in length. Now in upper area we are seeing feature. Among the first one is anal columns. So here you can make out these are the anal columns we have got. This is nothing but longitudinal folds. And then this anal columns are going to end up in semilunar fold here. So these semilunar folds are called as anal columns, which are 16 in number. First, so first picture is this one, anal columns, and then we have got anal valves, this one, and then we have got anal papilla, which is an epithelial part projecting outwards from the anal valves, and then we have got sinuses, nothing but spaces over here, and then we will be having anal glands, which will be seen over here. Have got intermediate and lower area divided by a line called Hilton's line, and this Hilton's line is nothing but a demarcation formed between bluish pink area of intermediate part and black area of the outer region. So we have got a demarcation seen between the pink and black. We will call that line is Hilton's line. So below the Hilton's line, this area we will call as lower area or as anal verge. It is about 8 millimeter in length and it is lined by skin, and in adult male it will be having coordinate line usually act as watershed line because we have got many changes happening in the upper and lower area of the spectinate line. So some of these are, we have got upper area and lower area divided by the spectinate line. It will be different developmentally and by its arterial and nerve supply. We will see that. So in upper area, the development is endodermal. It is from endodermal cloaca. The lower area which will develop from ectodermal proctodium. And talking about arterial supply, the upper part it is supplied by superior rectal artery, the lower part by inferior rectal artery. If you are taking venous drainage, the upper part it is drained by portal system, the lower part will be drained by systemic veins. And the lymphatic in the upper part will get drained into internal iliac lymph nodes. In the lower part, it will go to superficial inguinal lymph nodes. Talking about nerve supply, it will be having upper part with autonomic nerve supply, which is pain insensitive. The lower part by somatic spinal nerve supply, which is pain sensitive. So because of these regions and because of these differences, the pectinate line will act as watershed line of anal canal. So 85% of anorectal disease will occur at this point of line. So now we will move on to some applied significance of the veins present over here. So distended varicose veins above the pectinate line will cause internal hemorrhoids, below the line will cause external hemorrhoids. So this is the internal venous plexus which is seen just above the pectinate line here. This is the external venous plexus. So talking about Hilton's line, as I said, it is a color differentiation between bluish pink and blackish color, and it is felt as intersphincteric groove at the lower end of internal anal sphincter. So in the middle part of internal anal sphincter we have the pectinate line. In the lower end of internal anal sphincter we have got this Hilton's line present. And we have got some significance for this Hilton's line, that is, it is going to indicate the lower end of internal anal sphincter, and ischiorectal abscess may communicate with anal canal at this point of line. And now we have got some muscles surrounding this anal canal which is going to support this anal canal, and that is, as I said, we have got outer external anal sphincter and inner to that we have got internal anal sphincter. So here, this is the internal anal sphincter we have got, which is thickened circular muscle fiber. In the lower end of the rectum, it will be seen. It is going to surround the upper 3/4 of the anal canal. And in the middle of internal anal sphincter, you know, it is going to correspond the pectinate line. The lower end going to correspond the Hilton's line. The nerve supply of this internal anal sphincter is superior hypogastric plexus, that is sympathetic nerve supply. Parasympathetic it is by pelvic splanchnic nerve supply. About the interior features, especially along with the which is thickened circular
So in
muscle
this
fiber
video,
in
we
the
are going
lower
to see
end of the
details of
rectum it
anal
will be
canal.
seen. It is
So
going
which
to
is considered
surround
as
the
a
upper
terminal part
3/4
of
of the
alimentary
anal
tube.
canal.
About the details of
And
anal canal, we
in the
will get
middle
to
of
know in
internal
this
anal
video.
sphincter, you know, it is
In
going
this,
to
we are
correspond the
going to see
pectinate line. The
detailing
lower
about
end
the
going to
interior
correspond
of
the
this anal
Hilton's line.
canal
The nerve supply
and
of
with
this
the details
internal
of
anal
the
sphincter
lines which
is
is dividing the
superior
interior and
hypogastric
what are the
plexus,
features
that is sympathetic
seen
nerve supply.
differently in
Parasympathetic
above
it is
those
by
lines
pelvic
and below
splanchnic
those
nerve
lines.
supply.
So about the
About the
details of
interior
the
features,
interior
especially
especially we are going
along
to
with the
see in today's video.
thank you.
So talking about anal canal, it is considered as you know, some general features we will see. It is the terminal part. So it is considered as a terminal part of alimentary tube. So it is a terminal part of alimentary tube and it is actually beginning. So it begins at anorectal junction. So it is beginning at the anorectal junction and then it will become narrow. So it is continuation of rectum only, but compared to rectum it will be considered as narrow part. That's why we will divide that whole of the terminal part into rectum above and below anal canal. And this anal canal, it is going to pass downwards and backwards. It is going to pass downwards and backwards. And then it will reach the pelvic diaphragm where it opens as anal orifice. So it opens at anal orifice. So likewise we have got general features of anal canal, which is considered as terminal part of alimentary tube, and it is going to begin at the anorectal junction where it becomes narrow and then passes downwards and backwards to reach the pelvic diaphragm, and then it is going to open at the anal orifice. To talk about some peculiarities of this anal canal. So we have got some peculiarities compared to other alimentary system for this anal canal. Those are, first thing is the anterior wall. Usually the anterior wall of the organs which we are seeing will be larger. So here the anterior wall is shorter compared to the posterior wall. So anterior wall is shorter here, and then it is going to get surrounded by sphincter ani muscles. Surrounded by sphincter ani muscles. So which is not seen in other part of alimentary tube. So these two are considered as some peculiarities of this anal canal. Anterior wall is shorter than the posterior wall, and it is surrounded by sphincter ani muscles. To talk about the length of it, it is about 3.8 centimeter, and we will see some relation. Just I will get through. You can compare with my PPT which I am going to provide you. So in that relations are explained clearly. Now here in the schematic representation we are going to deal more about the interior of this anal canal. So in relation, if you are seeing anteriorly, it is different in male and female. In male we have got bulb of penis with spongy urethra. In female we have got lower part of posterior wall of vagina. And in both the things we have got a perineal body also related in front. Talking about behind, we have got a raphe which is connecting the anal canal and the coccyx, and that is called as anococcygeal raphe. And on each side we have got ischiorectal fossa with its contents. Now we will move on to the major part which we are going to see now, that is interior of the anal canal. So we are going to deal about the interior of anal canal. Interior of anal canal. So to talk about the interior of anal canal, we are going to divide this anal canal into three parts. So we have got our anal canal. So consider this as our anal canal. So here we have got two lines dividing it. We have got above one line and below another line, which is dividing the whole of the anal canal into three parts: upper part, intermediate part and lower part. So this is upper part, intermediate part and the lower part. And the lines which are dividing us, this line is called as pectinate line. So the above line is called as pectinate line, the lower line is called as Hilton's line. So this pectinate line you will understand while we are seeing the features of the interior of anal canal, how it is formed. The Hilton line is nothing but the color demarcation between the intermediate and lower part. Here it will be bluish pink, in the lower part skin will be there, so it is black in color. So the demarcated part between these two areas will be considered as Hilton's line. Here we have got a feature coming from upper part going to form the pectinate line. So this is how we are dividing the interior of anal canal: upper part, intermediate and lower part by means of two lines, pectinate line and Hilton's line. Now we are going to see about each part separately. So first we are going to see about details of upper part. So first we will deal about the upper part of anal canal. So we are going to see all the three parts separately. First we are going to see details of upper part. So interior we are seeing in that upper part of anal canal. Interior we are going to see. So talking about the upper part, as you know, we have got our anal canal. In this we have got our pectinate line and Hilton's line. Here about this whole part we are going to see. So this is considered as upper part. This upper part, it is about 15 millimeter in length. So if you are seeing the length of upper part, it is about 15 millimeter, and it is lined by simple columnar epithelium, and it is covered by internal rectal venous plexus. So always this area will be plump red. So we will be having color demarcation here. Here the upper part, it will be plump red in color because of the internal rectal venous plexus which will be seen on either side of this upper part of anal canal, which is going to give that colorization, that is plump red. Then we are going to see about the features separately. So now we will move on to the free features. So as I said about the length 15 millimeter, and it is lined by simple columnar epithelium, which is different for all the things. So simple columnar epithelium, and it is plum red because we have got internal rectal venous plexus covering this. Now we will get to know features. So we are going to see some features, such as we have got 6 features seen over here. So major we will see about 5 features, all the other features is very simple. So we are going to deal about 5 features. So we are going to deal about 5 features of the anal canal. So among that, first feature which we have got is anal column. So we are going to deal about first feature, that is anal column. So talking about this anal column, it is otherwise known as column of Morgagni. Column of Morgagni is nothing but anal column, and this is considered as permanent mucus folds which is seen in this anal canal. So we are talking about the first feature of the upper part, interior. Among that, we have got anal column as first feature. So this is the anal canal, and this will be the pectinate line. So here we have got this anal column, which is a fold which is coming longitudinally. So likewise we will be having folds extending. All these are mucus folds. These are permanent mucus folds which are longitudinal in its direction. This is anal columns. So this anal columns will be considered as first feature of the upper part. So in first feature, upper part, we have got anal columns which are nothing but permanent mucus folds, and it is longitudinal in direction. Now we will move on to the second feature. So talking about second feature, so I'll show you here. Second feature, that is anal valves. So we have got anal valves as second feature, which is otherwise known as valves of ball. So anal valves or valves of ball, these are again nothing but we have got our upper part of anal canal, and then we have got our pectinate line. As you already know, we have got mucus folds here, right? So we have got mucus folds extending here. Here in the lower part, we have got connecting all this anal column, a crescentic fold will be extending likewise. We have got connecting these mucus folds. From above, we have got some crescentic fold extending, and this fold is called as anal valves. And this anal valve is nothing but the pectinate line. So the line which we are drawing at the level of anal valves are called as pectinate line. So pectinate line, which we have seen before, which is dividing the line which is responsible for dividing the anal column, is nothing but the line connecting the anal valves. So anal valves is the second feature of the anal canal. So upper part we have got 5 feature. Among the 2 feature we have seen, one is anal column which are longitudinal mucus folds, another one is anal valves which are crescentic mucus folds seen in the lower part connecting all these anal columns. So which we will call as anal valves. Now we will move on to the third feature. So we are going to see about the third feature now. So talking about the third feature, we have got our anal papilla. So third feature which we have got is anal papilla. So anal papilla we are going to see. Again we have got our upper part of anal canal. So in this upper part, as you know, we have got our pectinate line, right? That is formed by the crescentic fold. So we have got anal valves which is forming this pectinate line. This is anal valves. From this anal valve, we have got a part of epithelial process projecting from this anal valve outside like this. So this is the epithelial process which is projecting from the anal valves, which is considered as anal papilla. So this is nothing but anal papilla. So this one is anal papilla. The epithelial process which is projecting out from the anal valves, we will call that as anal papilla. And now we will move on to the fourth feature. So we have seen anal column, anal valves and anal papilla. Now we are moving on to the fourth feature. That is, we have got our anal sinuses. Anal sinuses. This is also simple, nothing. We have got again our anal valves. So we have got here pectinate line, and here we have got our anal valves, right? So from there we have got anal papilla also coming out. Now the space which is seen or the recess above the anal valves are considered as anal sinuses. So the space which you are seeing above the anal valves is considered as anal sinuses. So this is anal valve. The recess or space above this anal valve, this space is considered as anal sinuses. This is usually important because foreign bodies are get impacted in this anal sinuses. So we have seen four features. One is anal columns, another one is anal valves, the third feature is anal papilla, and the fourth feature is anal sinuses, which is space above the anal valve. Now we will move on to the fifth feature, that is anal glands. So we are going to see the fifth feature. So we are going to see about the fifth feature. So we are going to see about the fifth feature now. So that is anal glands. So we are moving on to anal glands now. So talking about anal glands. So talking about anal glands, again we have got our anal canal with the pectinate line, and here we have got the anal sinuses. So we have got anal valve with anal sinuses which is present above. Here on either side of this we have got our anal glands present. So here we have got our anal glands. On either side of the wall of anal canal we have got our anal glands. So these glands are going to open up in the anal sinuses here. So these glands will open up in anal sinuses which are present above the anal valves. So it is considered as the glands which is going to pour on its secretion inside the anal sinuses. So the anal glands are present on either side of the anal canal, outside the wall of the anal canal, and then it is getting poured into anal sinuses. So these are the 5 important features of the anal column or anal gland and anal sinuses, anal papilla we are get to see inside the anal canal. So this is how features are seen. I will summarize again. We have got, so we have seen 5 features. So see here, this is the first feature which we have seen. So 5 features, among that we have got anal column, the longitudinal folds, and then we have got anal valves which is seen in the lower part, and then we have got our, so here you can see, and then we have got a feature that is anal papilla, which is epithelial process projecting out of anal valves, and then we have got our anal sinuses, the space above, and then anal glands which is pouring into anal sinuses. So now we will move on to the intermediate area. So these are the 5 features seen in the upper area. Now we will move on to the intermediate area. I'm sorry about it. I'm sorry. So now we are moving on to the intermediate area. So talking about the intermediate area, so we are going to see intermediate area, again it is 15 millimeter. Intermediate area we are going to see. So this intermediate area, again it is about 15 millimeter. So as you know, we have got anal canal which is divided by 2 lines, pectinate and Hilton's line. This is upper area, and this is intermediate area, and this is lower area. So in this intermediate area we are going to see this is again 15 millimeter in length, and this intermediate area is present between the pectinate line which is seen above, and then here we have got our Hilton's line. So between that we have got this intermediate area. So this intermediate area have got some features such as it have not got any more important features like upper area. Upper area have got 5 features here which we have as all general features such as it is lined with non-keratinized, stratified squamous epithelium, whereas in the upper part it is lined by simple columnar epithelium. So here we have got this type of epithelium, and then the area is surrounded by again internal rectal venous plexus. So that is going to give bluish pink color. So bluish pink color is the color seen in the intermediate area because of the internal rectal venous plexus. Internal rectal venous plexus. Because of that it have got bluish pink color. So here in the intermediate area we have got a color over here that is bluish pink color because of the internal rectal venous plexus covering it. And then it have got rich blood supply and also nerve supply seen in the intermediate area. So these are the features seen in the intermediate area, nothing much. The length we have to discuss, and then the lining epithelium is different compared to the upper area, whereas it is simple columnar. Here it is non-keratinized stratified epithelium, and the color here is bluish pink color. Now we will move on to the lower area. So we are going to see about the details of lower area. So this lower area is otherwise known as anal verge. So that is the area which is seen below. So here we have got feature otherwise known as anal verge because it is the terminal part of the anal canal, and then it is lined by true skin. So the color will be blackish in color. So lined by true skin here. So the color demarcation between the bluish pink color and the black color here. This differentiation is leading to a line here that is Hilton's line. So the line demarcating the bluish pink and the black color is called as Hilton's line. So these are about the details of the interior of anal canal we have got. Now we will deal about the lines which are seen over here, which is dividing the anal canal into 3 areas, that is pectinate and Hilton's line. So first thing we are going to deal about pectinate line. So we are going to deal about pectinate line. So talking about pectinate line, it is nothing but mucocutaneous junction. So as you know, we have got the anal canal which is divided by 2 lines, that is pectinate and the Hilton's line. So in this we are going to deal about the upper line first. This is pectinate line, which is nothing but mucocutaneous junction because above this part is mucus covered and here we have got skin area. So this area or this line is considered as mucocutaneous junction. Mucocutaneous junction. So it is nothing but mucocutaneous junction we have got, and it is going to correspond with the anal valves. As we already have discussed, it is going to correspond the anal valves. So pectinate line is nothing but the line which is corresponding to anal valves are called as pectinate line, and it is going to divide the anal canal into upper area and lower area. So upper area and lower area. Now we are just dividing the pectinate line. By means of pectinate line we have got only 2 areas, upper and lower area. It is very important because it have got many different features seen in the upper and lower aspect. So about those importance we are going to deal now. So the important feature first what we are going to see is the importance of the line. So talking about the importance of this pectinate line, it is different developmentally, arterially and lymphatic, venous drainage and also nerve supply. Everything is different compared to upper and lower area. First we will discuss about the developmental difference. So developmental difference. And then we are going to deal about arterial supply. Then we will deal about venous drainage, lymphatic drainage and the nerve supply. So how it is different we are going to see now. So we have got our anal canal which is divided into upper and lower by means of our pectinate line, right? So we have got our pectinate line dividing all these things. First we are going to see about developmental differentiation. So talking about developmental differentiation, the upper area and the lower area. The upper area is developed from endodermal cloaca. So here the developmental origin is from endodermal cloaca, and the lower part it is by ectodermal cloaca. Ectodermal cloaca. So this is the major difference from the upper and lower part. So developmentally it is different in upper part and lower part. Upper part endodermal, lower part ectodermal. Talking about the arterial supply, again we have got upper and lower. Upper area, lower area. Here the arterial supply in the upper part is by superior rectal artery. So here we have got superior rectal artery, and the lower part it is supplied by inferior rectal artery. Inferior rectal artery. So upper part it is supplied by superior rectal, that is above pectinate line, it is supplied by superior rectal artery. Below it is supplied by inferior rectal artery. Then talking about venous drainage, we have got again upper and lower part. Upper part is supplied by superior rectal vein, which is in turn going to drain in portal system. Here we have got inferior rectal vein, which is in turn getting drained into systemic vein, that is vena cava, inferior vena cava. So venous drainage again different, upper part superior rectal, below part inferior rectal vein. Then talking about lymphatic drainage. So if you are seeing lymphatic drainage, again in the upper part all these will drain into internal iliac lymph nodes. Internal iliac lymph nodes. The lower part it will drain into superficial inguinal lymph nodes. So this is the difference between upper and lower part. Upper area getting drained into internal iliac lymph nodes, lower area getting drained into superficial inguinal lymph nodes. Then we will move on to nerve supply. Talking about nerve supply, the upper area. The upper area will get drained by means of, nerve supply, it is innervated by means of both the things. That is, we have got our sympathetic and parasympathetic. So sympathetic and parasympathetic, we have got sympathetic by means of superior hypogastric plexus, and we have got superior hypogastric plexus, it is the supply which is going to give sympathetic innervation. Parasympathetic, it is by pelvic splanchnic nerves. So pelvic splanchnic nerves is going to get parasympathetic nerve supply for the upper part. In the lower part it is drained by, it is supplied by somatic spinal nerves. So this is the difference between upper and lower area. In the lower area for the skin we have got somatic spinal nerves. In the upper part it is supplied by sympathetic and parasympathetic. So this is how we have got our nerve supply. So lymphatic drainage it is by internal iliac lymph nodes, and below part by superficial inguinal lymph nodes. So this is how we have got division of the pectinate line and their importance. Pectinate line is nothing but the line which is going to correspond the anal valves, and it is a mucocutaneous junction corresponding the anal valves. These are the difference: developmentally arterial supply, venous drainage, lymphatic and nerve supply. And then we have got some important name for this because of all this importance, that is, it is also, the pectinate line is also considered as water shed line because of the differentiation between the two areas. So it is called as water shed line, nothing but the pectinate line, which is dividing into upper and lower area, water shed line. So now we have got all these features to remember, such as we have to say detailedly about all the interior of anal canal with all the three parts and their importance, and then we have to talk about pectinate line, how it is different in all this way, and what is the importance of this pectinate line we have to tell. And talking about Hilton's law, so I will tell you. So we have got again our Hilton's law remaining. So Hilton's line, it's not Hilton's law, it is Hilton's line. So Hilton's line is nothing but the line which is going to divide the intermediate and lower part, as you know. So we have got anal canal, pectinate line and the Hilton's line. So this is the Hilton's line. So it is going to divide intermediate area and lower area. It is nothing but color contrast. So it is considered as color contrast between the bluish pink color, that is above, bluish pink area above and black area below. So that demarcation we are calling as Hilton's line, and then it is going to indicate the lower end of, so this is the line which is going to indicate the lower end of internal anal sphincter. So about these muscles I will be discussing in the PowerPoint presentation. Do check that so that you can understand all these things clearly again. So we have talked about the interior here in detailed account. So about two lines you have to talk, pectinate and Hilton's line, and the areas which are divided by it in detailing. Applied aspect, if you are seeing, we have got a condition called anal fistula happening. So applied or clinical aspect, we have got a condition called anal fistula, where narrowing of anal canal will happen. So these are about the details of anal canal. Thank you for listening.